Have you ever thought about getting cosmetic surgery on your nose, but you had concerns about the surgery itself and the recovery time? Well, this morning we have Highland Park board-certified plastic surgeon, Dr. George Toledo. He has also brought along with him a patient, that's Cindy, and we're talking about rhinoplasty today. Dr. Toledo, how are you?
Oh, I'm great. I'm glad to be on the show.
I am too, and Cindy, we're so glad you're here. We're going to get to your story in just a moment, but Dr. Toledo, you are regarded as one of the top plastic surgeons in DFW and the United States, so it's really great to have you here. Let's talk a little bit about the center, and I want to hear a little bit more about yourself.
Well, I've been at it for 28 years in Dallas, and I have a surgical facility in Highland Park. So it's kind of a unique place. The patients come there, have surgery, they spend the night if they need to. It's extremely clean. We don't have any, knock on wood, infections. It's very private, and so, you know, my patients can come in and out without anybody knowing.
That's great. And that's
very important.
Of course. It's a very personal decision to come and see you, and they want to feel that they have their privacy. And as Cindy came to you wanting to change some things about herself, so what did you determine about Cindy when she came to you?
Well, Cindy wanted her nose done. She's hated it all her life, and it was very large. It was out of proportion to her little bitty face. And so we had a consultation, and we determined how much we needed to do. I listened to what her desires were, and then I did my recommendations, and we actually put her on an imaging machine. You can see on the imaging how we rotated the tip about 5 to 10 degrees and took down the hump and narrowed it. And she had a little deviated septum, which we straightened out as well.
And she is just 2 weeks out, Doctor. Cindy, you can look at me, and the camera can really see your profile there. That is amazing. You just took off the splint today.
Yeah, this morning she came in for her second post-op visit. So.
Wow. How are you feeling, Cindy? Tell me about your experience.
I feel very great, thank you. I mean, I've always hated my nose. And I saw a friend in Tyler, and I asked her, you know, who did your nose? It looked really great. And she said, Dr. Toledo. So then I researched him and everything, and then I saw it was the American Board of Plastic Surgery.
Right, which made you feel more confident.
And then I researched his website, and he was a board certified. So that made me more confident in him and me. So
of course, and this is something that Cindy's thought about for a long time. It was an important decision. I'm sure she was so nervous, but she did her homework. So talk about what it means to be a board certified plastic surgeon. You
know, very few patients do this much research. I mean, I guess almost 90% of my patients come from word of mouth referrals. But to get online and go to the American Board of Plastic Surgery website and do your research, you know, she took it to another level.
Yeah.
There's a lot of doctors doing plastic surgery that aren't even plastic surgeons, much less even certified plastic surgeons. So you got to be careful today.
Sure, you want to do your homework. Well, a lot of viewers always ask us the tricks of the trade, and we want to pick your brain for a moment because we want to turn the clock back and all look younger. So what are the most effective procedures for that?
It seems like my patients are divided up into two sets. I mean, the 30, 40-year-olds that want the mommy makeover type procedures, the tummy tuck, liposuction, and breast surgery, and then the 50 and up that now the aging face has taken effect, and they, you know, they want their eyelids and their neck and forehead lifted, and it's more of the facial rejuvenation type procedures.
And looking natural and looking good.
Yeah,
and
hopefully take back the clock as far as you can naturally.
Okay.
You know, that's the goal.
Okay, so how does somebody contact you to find out if they're a good candidate for cosmetic surgery?
The easiest way is just to get on my website. It's ToledoPlasticSurgery.com. And there's contact information there. Anything you want to know about plastic surgery is pretty much there. You can shoot us an email. Out-of-town patients can send us their photographs, and we can do a online consultation, set them a trip in.
Oh, that's great. So really, I'm sure you do get a lot of people from around the United States who want to come here and utilize your facility because, as you said, it sets itself apart because of the privacy. But there's other features, too, that make it a comfortable environment.
It's very efficient. You know, I have patients that say, oh, I went to the hospital, had this surgery done. Well, I had to get there at 5 o'clock, and I had to lay on a gurney, half naked, with 20 other patients waiting for my 7 o'clock tea time, which was really at 8:30. So I mean, it's extremely, inefficient process and not very private. So it's nice to have your own facility.
Of course it is. Well, Dr. Toledo, it was wonderful to meet you. Thank you for sharing Cindy's story. And Cindy, you look great. I'm so glad that you're feeling good.
Thank you.
Just 2 weeks out. Way to go. All right. Here's all the information you need to know. If you want to call Dr. Toledo, call this number, 214-363-4444, or check out his website, ToledoPlasticSurgery.com. Carrie?